Today we're going to be talking about telehealth, which is a new way to access quality healthcare through your health benefit plan. My name is Christopher Glenn, and I'm one of the group relations specialists here at School Care. First, we're going to go over what really is telehealth medicine. We'll then go over a couple of reasons of why to use telehealth. Then we'll review some common conditions that would be utilized under the telehealth benefit. And then we'll finish up by how to access telehealth under the Cigna program. Telehealth medicine is defined as the use of electronic information and telecommunications technologies to support long-distance clinical healthcare, patient and professional health-related education, public health, and health administration. For purposes under the School Care program, this is just another added benefit to your health plan. Telehealth can be referred to as two different things, one being telemedicine, the other being telehealth. In regards to School Care, we call this program an added benefit as telehealth, but in other cases, if you look out in the marketplace, some other health organizations do call it telemedicine. Here are the top 5 reasons we believe why you should use telehealth. It's fast, convenient, and comfortable. You can access it on the go. You can access it at home. If you didn't want to pack up your children and go to a doctor's appointment, you don't have to. You can do it in the comfort of your own home. 2, it reduces the contagion risk for you and any dependents that could be at risk. We all know the signs at the doctor's offices that say if you have a cough or you're sneezing, please put a mask on. The use of telehealth services reduces that risk and actually negates it because you don't put yourself in that situation. Number 3 is collaboration among healthcare professionals. The great thing about telehealth is once you are completed with your telehealth session with a board certified doctor, they can submit all of the notes and information from your visit to your primary care physician or maybe a specialist that you want to follow up with. So that keeps that collaboration between the telehealth provider as well as your primary care provider. Number 4, easy follow-up care. This goes over if you needed a prescription or if you needed to do any follow-up care such as physical therapy or occupational therapy. Having that information sent from the telehealth provider to your primary care or a specialist helps you to follow up on something maybe in 6 months that you needed to do, or if you needed your prescription right away, the telehealth provider can prescribe it at the time that you have the telehealth session. Then you can pick up that prescription at your convenience. The number 5 reason to use telehealth is it is a lower cost option. Everyone knows about urgent care and emergency room care. Those are for specific situations that you absolutely need help. Telehealth is just a lower cost option to help with different scenarios that are less severe. Through the Cigna telehealth program, on anyone on our consumer driven plans, it is a $42 flat fee. If you were to use an urgent care facility, it can average you a cost up to $180. And same thing if you were to visit an emergency room, it can cost upwards of $1,600. Anyone on our copay plans, the telehealth session would be the same as your office visit copay. Some common conditions that you want to use telehealth for, things such as allergies, ankle and arm sprains, cold and flu, insect bites. One situation that I've heard people use this for is tick bites in the summer. Conjunctivitis is another one of those items that you need to visit with a doctor, but you don't want to make a separate doctor's visit for you or your child. So telehealth, you can do it right from your home and pick up the prescription at your earliest convenience. Rashes, skin inflammations, sore throats, urinary tract infections, or other minor sports injury. Keep in mind you want to think of appropriate level of care when thinking about using telehealth. Such things as lacerations, abdominal pain, shortness of breath. You're going to want to visit an urgent care or an emergency room facility because those are a little more extreme cases that telehealth would not be a good resource to use. You can access the telehealth program through your mycigna.com account. Once logged in, go to the bottom of the page where there is a blue box called Cigna Telehealth Connection. Once you click the Explore My Options section, it'll bring you to a new page showing the guidance and medical care section you see in front of you. For both Amwell and MD Live, you can actually click Get Started and start making your own account under either one or both if you wanted to do both. Once your account has been made, you can utilize telehealth for yourself, or if you make an account for a dependent, you can utilize it for them as well. Telehealth through Amwell and MD Live both are accessible through mobile apps. You're going to want to make sure to choose Amwell for Cigna or MD Live for Cigna, whichever one you choose. They do have a direct connection with the providers that are covered under the National Open Access Network through Cigna. There are other applications for both Amwell and MD Live, but you just want to make sure you choose the one for Cigna. Where can you use telehealth? Essentially anywhere that you can utilize either a phone or an online connection. Most people use it at home. If they have a child sick at home, or if they're sick at home, they can use their home computer, or they could use their mobile app to have a face-to-face conversation with a board-certified doctor. I know some people do use it at their own office or at school, but some people also use it on the go. You can actually have just a conversation with your doctor through the telehealth session instead of having a face-to-face visual appointment. The great part is all of these have a common theme and they're at your convenience, so you don't have to set an appointment. You can do it at your leisure or whenever you think is necessary to use telehealth. And that's it for the webinar. I want to thank you for reviewing the telehealth services, which is an added benefit to our school care health benefit programs. But if you do have any questions or want to clarify anything from this webinar, please feel free to give us a call at 1-800-562-5254,